afternoon, and good evening, depending from where you're watching from. This is Dr. Marcy Mutahi, and as usual, we are all about preventative care because prevention is better than cure. Curative medicine is well talked and well known from the clinics to the major hospitals that you know. But here we are all about preventative medicine, and today I'm bringing you all you know it about fever. And what is fever? Fever is a raise in temperature or of body temperature from where normalcy is. Normally, below 37 degrees, it's known as normal temperature. But above that, we call it fever. So when you go to the hospital, they triage. In the triage, if it goes above that, we determine the cause. So let us talk about those causes that bring fever so that we know how to prevent them. Number one cause of fever is before we give causes, let's talk about what we normally give. Paracetamol. We normally give paracetamol to reduce fever, but while we give it, we do not treat the cause, because once we give paracetamol, the fever goes down. And no, right now I want to tell you the effects of giving paracetamol. Paracetamol is eliminated in the liver, and too much usage of it can result to liver failure or liver damages. So let us not be giving paracetamol every now and then before knowing what is causing that fever. Okay? So let's talk about the causes now. I will do head to toe. Let's start from the head. When you have an eye infection, when you have an ear infection, when you have an oral infection, when you have a brain infection like meningitis or encephalitis, that is inflammation of the brain, will cause fever. So before you go and give paracetamol, examine all those areas, whereby starting from the eyes, do you have any infection of the eye? Do you have any infection around the nose? Do you have any infection on the mouth? All ears, all the brain that is bringing the fever before you give that paracetamol, right? Now let's go to the neck. We all know about tonsils. Tonsils can bring you fever. So ensure that before you give paracetamol, you get checked, right? Another thing, we go to the chest. If you have a chest infection, starting from pneumonia, starting from bronchitis, starting or TB or any other, it will give you, whether it's a viral or it's a parasitic or it's a bacterial, will give you fever. So again, before you run to the chemist to buy paracetamol, get to know what is causing fever. GI issues, the gastrointestinal issue or stomach issues like diarrhea, stomach pain because of maybe appendicitis or any other will give you fever. Pelvic issues will also give you fever, like UTI, urinary tract infection, will give you fever. STD will give you fever. So ensure before you get checked, you have what? Or before you take your paracetamol, you have gotten checked.